So this patient is 52, and she asked me to correct, the depression, so the tear trough she has under the eyes. So I will not do a triple jump with a back flip on the patient and 50 syringes, but I will just do like I do in my office. So first, I I do a technique called ATP. It means first, I will show you the anatomy on the patient because I want to have the safety first. Then T will be the technique I will choose. And last, the product. So it's always, for me, the same order. When I inject my patient, I just want to show you first the anatomy, then the technique I will choose, and last, the product. And not first the product, then the technique, and last the anatomy. So here, you see very well for this patient, if she look up, you see very well, you see the depression here, that is the tear trough, and here also you see the palpebro-malar groove. So this is what I will inject. Where are the dangers? The dangers, if you turn a little bit the head of the patient, you see a little depression here. That is the nasojugal groove. And you will see with the video of this afternoon that in this area here, this is where your fascial artery is running. And this fascial artery is running above the muscle. So it means that if I have to choose one plane to inject, I will inject in this area here, very deep, just to avoid the danger here. So this artery is going up here, above the muscle, and then here, perforate a muscle called the depressor supercilii, just after to be deep in the glabellar area. So this artery is well identified here. In the mid-cheek groove, what you have normally in 80% of the patient, you have the fascial vein. But the fascial vein is not a danger, just only for the little bleeding you can have, but it's not a danger really for a big complication or an embolism. You have also here the mid-pupillary line, and a little bit at the medial part here, you will have the foramen of the infraorbitalis nerve. So if I summarize, here in the middle part of the mid-pupillary line, there is all the dangers: infraorbital nerve, fascial vein, angular artery, and on the lateral side of this mid-pupillary line, you have no danger. So now I show you the anatomy only through the safety point. I will tell you a little words about the technique. You have two techniques. The first will be with a needle. The second one will be with a cannula. And you have two planes, the superficial one and the deep one. If you use a needle in this area, the average length of a tear trough, do you know what is the average length of a tear trough? It's around 40 to 42 millimeters. And the length of a needle you have in your blister, do you know what is the length? It's 13 millimeters. It means that if you want to treat, the tear trough completely, you will have to do 3 punctures with your needle to erase your tear trough. It means 3 times more bleeding, 3 times more swelling, 3 times more danger to reach an anatomical, a landmark. So for me, I will use a cannula because I don't want my patient to have bruising after swelling. because you know that here, the swelling and the bruising, I don't know if you had, but it will last a long, long time around the eyes. So I want to avoid, any bruising in this area. So I will use a cannula for this. Which cannula I will use? This is also a technical point. You need a cannula that will allow you to reach the inner part here of my tear trough. So it means the length of my cannula here will need to be enough to reach this point. And the length here, I calculate before I will do my injection, it's around 42, 44 millimeters. So I will use a 50 millimeters length cannula. And I want also my cannula to be rigid, just to know where I'm going and where is the tip of my needle. I want to feel the tip of my cannula. So it means that for this area, I will use a 25 gauge cannula that is rigid enough, so I will know when I will push my syringe, where will go my cannula, because it will be straight with my syringe. So here I will use a 50 millimeters length cannula and a 25 gauge. And after, will I be superficial or will I be deep? This is a big question, and a lot of people now, there is a big controversy on that. For me, the tear trough increase with age because you lose the bone. Your orbit is going backwards. So if I want to correct an aging process, I need to mimic what the aging process is doing. So because I want to mimic the aging process, I will inject deep and not superficial. Sometimes, but in touch-up, I can add a little bit one of redensity 2 above the previous injection, because it could exist a gap between the fat pad here that you see very well and what I will inject here. So between what I will inject and the fat pad, it could persist, you can still have some lack of volume, a little depression between my fat pad and what I inject, and I will inject superficially in this area, but not at the beginning. Then, which product I will use? There is only one product. Yes? Yes. No. 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 At the second time. I never inject in the same times 2 planes in this area. I don't want to have any swelling. So first, I want to safety first. I want to sleep. I know what is, how you are, sad and tired if you don't sleep. So I want to sleep. I don't want to have a phone call of my patient, say that she has a big swelling, a big bruising. So first I inject deep on the bone, in the bone origin of the orbicularis oculi muscle. You will see that this afternoon. And all the time, my patient, this is my protocol, whatever the injection I will do, my patients always come back in my office 3 weeks after just to check. If you don't see your patients after 3 weeks or 1 month, you will not have the feedback of your injection. And then I do the touch-up. But I say to my patient, when I do my first injection, perhaps you will have a touch-up. This one will not need any touch-up. So I go on with my technique. So cannula, 25 gauge, 50 millimeters, entrance point in the soup, very safe. My cannula will slide on the bone, reach the depression, and I will inject slowly the product. So which product I use? I use Redensity 2. This is the only product that is very specific for the periorbital area. Why? Because it has a low hygroscopic rate. It means that the hydrophilic property of this product is very low. So you will have no swelling when you will inject in this area, and you will have no bruising. So what you will inject will be what will stay. When I do my injection, also a point of technique, do you know what is the best level to inject your patient? It's what we do in surgery. The best level to inject will be the level of your elbow. It means that your injection site needs to be where is your elbow. So you need to go up or down with your table just to put your patient in the right position. So if I summarize, dangers here, superficial, so I will be deep in this area. Here, I will start with a cannula with an entrance point in this place, in the soup. No dangers. My cannula will fill this area, and I will do it on the other side to show you, and I will have time to explain to you each step. So I turn a little bit the head of my patient, and I will make a disinfection. I will use a little special device. So here you see this is my patient. I will a little bit go down with my table. Yes? What do you mean by that? Could you explain? Oh, this patient is at the limit of the surgery. I never do, because I'm a surgeon, so I'm lucky I can do injection and I can do surgery. So I never push too far, you know, my injection, and I never do surgery if it's not necessary. So I change, you know, my injection way to do it, because, for example, if you put too much in the lower part, you will have a square face, and it's not a good indication. The good indication will be to do a facelift. When you have a bump on the nose, don't do injection, do a surgery. But when you have a tear trough at the beginning, do an injection, don't do surgery. So here, what I will use, I don't know if you see that very well on the camera, I will use an easy guide. What is an easy guide? It's a very clever tool to reach, you know, you see my bone here. I touch the bone, because like this, I know where I am, and I know where will be the tip of my cannula. If you don't do that, your cannula will need to reach the bone, cross the tissue, all the tissue, and it will be very difficult for your patient, because she will feel pain. Here you see, when I will put my cannula here, you see that I'm on the bone, okay? And I remove after the easy guide. And I'm on the bone. So here, that's very easy for me to slide on the bone and not to make pain to my patient. So can you take that? So here you see I'm on the bone in the soup, very safe, and my cannula will slowly slide on the bone. I have, you see, on my cannula some mark, just to tell me where I am. And when the soup finish, then the tear trough start. So here you see I start to inject slowly in my patients, slowly, and I start to be in the tear trough. So here, because my cannula is 25 gauge, my cannula is in the axis of my syringe, and my syringe will have the direction to the tear trough. So here, I will go up, and my cannula slide on the bone, and like this, you see no effort. My patient, she has no pain, because I'm on the bone, and on the bone there is no pain. And I will inject slowly. This is the secret, small amount of product. So I don't know if you see my cannula, but I'm in the tear trough. and slowly I inject in the tear trough. I put less than 0.5 for this patient. Do you see where is the tip of my cannula? You see how it moves up? And now I'm very high. I'm at the top of my tear trough. So it means that with my cannula, I'm just here, at the top. It's for that I took a 50 millimeters cannula. And then when I withdraw, I will inject slowly my product. So here, you see I'm at the top. And after, I will do the nasojugal groove. I'm very safe because I'm deep. And I slide on the bone so it's easy. So on one side, as you can see here, I will inject to this patient less than 0.5. Then I have finished. I just, just make a swap like that, just to erase, the product, but I do no massage. Why? It's because I put my product on the bone. The bone, if you are looking to my hand, it's like my hand here. If I put my product just at the top of the bone, and after I do a strong massage in the tear trough, my redensity 2 will move up and down. So for each injection in the tear trough I do, I never ask my patient to do a massage. You want the patient to sit? Can you sit? So here you see, you see one side here, and the other side, I feel all this area here, you see, until I reach the top of my tear trough here. Okay? Here, 0.4. So I try to put not a lot of product, but in the right place. Do you have any question? Because I think I have almost finished. So you see, it's easy, it's fast, it's safe, safety first, not a lot of product. So for you, it's not a huge amount of money. Sorry for the company. And so you can correct easily, a face with small aliquot of product. It's okay? Any question? Thank you very much. Look up. Look. So you see I'm at the top. I inject slowly. You see my product here. Dark. Slowly. So I don't need a lot. And because my cannula is very long, I can reach, you see where I am? I'm here. The last dark spot. No, it's because it's because I don't do any massage, because I don't want my product to spray away, because I put it in the right place. Sí, sí, sí. Yeah, it's good. No, it's okay. J'aime bien faire travailler mes patientes en même temps que moi. Yes, after? Oui. Parce que Ça fait partie de mon éducation, on m'a dit de jamais jeter. Ok, je vais prendre a little dressing, like this. Yes? It's okay. Thank you. Thank you very much. Okay? Donc, so they press a little bit on the entrance point, but they don't press on the... And look, she has no more. Yes, yes, we will do it. It's okay? It was okay? Yeah. Sì, 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 sì. È totale normale. Sì. Queste noi. Sì, sì, sì. Con il product. Finito.